Well, we were always told that euthanasia would just be for the terminally ill, those about to die. But of course, then it starts to expand and it becomes, what about mental illness, non-terminal illness? What about for minors? And now there's even thoughts around euthanasia for poverty and homelessness. Is that part of the slippery slope? Let's check it out. So Canada sets a example for where we could head with euthanasia. The requirements to seek assisted suicide, which in Canada are sometimes called medical assistance in dying, have been relaxed in Canada over the past several years, and the practice is currently available only for adults with severe medical conditions, not necessarily terminal, but the criteria will soon expand to include people with mental illness. In February, a Canadian parliamentary committee recommended that mature minors be allowed to seek assisted suicide as well. Mature minors, even without parental consent. So we've got mental illness and mature minors now. And sadly, this slippery slope will continue because when a newly permitted activity is characterised as a human right, the overseas experience is that there's an inevitable push to extend such a right to a greater number of people, such as those with chronic conditions, disabilities, mental illness, those simply tired of life, or even children. And in fact, even Marion Street alluded to this when the debate first started here in New Zealand. And there's new polling data from Canada which shows exactly why this slippery slope may occur. Now, at the beginning of May, a new poll was published in Canada on their attitudes to euthanasia. And in the online survey of a representative national sample, and they'd done one 2 years earlier, about half of Canadians are satisfied with the current arrangements around euthanasia. 27% are dissatisfied, so about a quarter, and 25% are undecided. So about half say great, a quarter say don't like it, and a quarter are undecided. Now, at this point in Canada, only an adult, as I said, with a grievous and irremediable medical condition can seek medical assistance. But Bill C7, which was passed in 2021, the beginning of 2021, eliminated the requirement that people must be terminally ill to die by euthanasia. Now, originally, Bill C7 excluded euthanasia for mental illness, but the Senate passed an amendment to the bill to require euthanasia for mental illness, and the government accepted the amendment, but with a 2-year moratorium for implementation. So that will start next year in March. Now, in this poll in Canada, respondents were asked if people should be able to seek medical assistance in dying because of 5 different reasons. Let me show you a summary of that. Half of Canadians, which seems to be the half of Canada that loves all aspects of euthanasia, would agree to allow adults in Canada to seek medical assistance in dying due to an inability to receive medical treatment or a disability. That's concerning, and Canadians are split when pondering if mental illness should be a justification for an adult to seek medical assistance in dying. 43% support the idea, 45% opposed, and the others unsure. Yet the Canadian government seems to be pushing ahead on this one. But then there's a bit less support for other categories. Look at those other categories. Fewer than 3 in 10 would consent to expand the guidelines to include homelessness, 28%, or poverty, 27%, as reasons to seek medical assistance in dying. I think it's shocking to think that homelessness and poverty would ever be justified as a reason for allowing someone to kill themselves. But here's the concern. If you look at the age breakdown of the figures, you find a disturbing trend. In the orange there is the 18 to 34 age bracket. So 27% of the whole population think you should be euthanized because you're experiencing poverty, but 41% of 18 to 34-year-olds in Canada support euthanasia for poverty. 28% generally support euthanasia for homelessness, but it's 41% of 18 to 34-year-olds. Homelessness. For mental illness, 43%, but for the 18 to 34-year-old age bracket, it's 54%. Now, remember, the federal government recently passed legislation which will allow euthanasia for mental illness starting next year. 50% supported euthanasia for disability, but it's 60% for that younger age bracket, 18 to 34-year-olds. And those results in the 18 to 34-year-old demographic paint a really concerning picture about Canada's future, doesn't it? And the societal harms of euthanasia legalisation in general. In February, a Canadian Parliamentary Committee recommended that mature minors be allowed to seek assisted suicide even without parental consent. That's pretty disturbing. Get an abortion, get euthanasia, transgender operation without parental consent. You can see what's happening to parents. But it is being all normalised in Canada. And here's a little clip of a documentary about a funeral home in Quebec. A funeral home offering space for medical euthanasia, for assisted suicide. And the company says it fills a gap in services, follow the money. But as the number of people choosing euthanasia in Canada increases, there's concerns about businesses profiting from the practice. Have a watch.
Welcome, follow me.
Funeral homes have been in Mathieu Baker's family for generations, but he recently expanded the kind of service he offers.
So this is the room where you have the medical aid in dying?
Yes, this is where it happens.
People who are approved for medical assistance in dying can come here with their doctor and loved ones to end their lives at a cost of at least $700.
It's a lot of organization on our part to really make it a respectful and meaningful event for that family.
It's what Michel Brunel recently opted for. His family says he had emphysema and his quality of life had deteriorated, but he didn't want to die at home or in the hospital.
They're using a room that they have already, decorated it very nicely, allowed us the time we needed to do what we had to do, to say goodbye, let him get comfortable. It's just a beautiful option.
A growing number of Quebecers have opted for medical assistance in dying since it became legal, from 63 people in 2015-16 to more than 3,000 in 2021-22. But this doctor says services to a company made outside of hospitals lag behind.
It really underscores lack of access, a lack of resources in the public healthcare system right now to have rooms available for people who do not want to receive their maid at home.
Tekla Henderson is with the...
Yeah, and of course, remember that it talked about people with an inability to get medical treatment, opting for euthanasia. Is that what we've sunk to? If you can't get the treatment because the health system isn't working too good, then euthanasia is an option? That's a scary thought in New Zealand, isn't it? Also in Canada, an Instagram influencer made a positive video about euthanasia. She asked her grandmother in the video, "Are you excited to die?" Let me show you a little clip of this.
As you like move closer to the day.
It's like the light at the end of the tunnel.
What are some of the precursors, like the questions they ask to make sure you're doing it for the right reason?
Your diagnosis is, if it's fatal, how many more months you have. They give you time to consider. They keep stressing the fact that you can always change your mind.
What is the actual day like?
I know, like, they set an appointment, special injection, putting you to sleep, and the big pain is the prick in the hand to provide for the little valves, and then once you're in a deep sleep, there are two other injections you get. At that point you go. So it's painless.
Would you prefer it be at home?
Well, I think in my case I would like to do it at the hospital. I came in quietly. I'd like to go out quietly.
Are you nervous? Are you excited? How do you feel?
Looking forward. Just putting an end to being dependent. No control.
So as the day approaches, is it something you're thinking about every day, or
no,
just it's going to happen when it happens?
Yeah, when I'll be ready, I'll know.
Yeah,
I've always made my own decision.
Yep, looking forward to it. Apparently, the influencer actually got quite a bit of backlash. She took her grandmother out to her last dinner before her doctors assisted her to commit suicide. And here's a little bit of a clip of that. Yeah, the video got more than 11 million views on TikTok, and from there she started posting multiple videos about her grandmother's choice for euthanasia. And People said she was using her grandmother's suicide to gain followers, clicks and views for her social media. She claimed that she just wanted to raise awareness about MAID and discuss it, MAID, which is euthanasia, what they call in Canada. And she disagreed with the notion that assisted suicide shouldn't be celebrated, claiming that suicide is only considered wrong because of Judeo-Christian values. Well, despite the fact that many non-Christians and many medical professionals and medical bodies also oppose euthanasia. You can see how this is all normalizing euthanasia. Oh, just one other example. The Euthanasia Activity Book was published last July by a group, Canadian Virtual Hospice. It was financed by the government, Health Canada. And of course, while there's ongoing debate about euthanizing minors, they released this. No connection? Yeah, right. The target audience is children aged between 6 and 12. The booklet is titled Medical Assistance in Dying Activity Book. The cover reads, "Welcome. These activities will help you think about medical assistance in dying by someone in your life." And here's how the book describes euthanasia. The word medical means the science of medicine, and assistance means help. And it says, so MAID means that medicine is used to help someone with their death. A doctor or nurse practitioner, a nurse with special training, uses medicines to stop the person's body from working. When their body stops working, the person dies. This is done in a way that does not hurt the person. The medicines help them feel comfortable and peaceful. A person has to ask for MAID and then go through a bunch of steps before it can happen. The steps are described below in this book. Well, that's how it explains it. For those 18 years or older, the book says euthanasia can be requested if they have a serious illness, disease, or disability that hurts their body or mind so much that it feels too hard to keep on living. And so, as you can see, critics have said that they're justifying suicide for those with mental illness or disabilities already. In fact, on page 5 of the book, the booklet reiterates that some people with disabilities will opt for suicide because they cannot make their disabilities go away. Critics say the message is crystal clear. Throughout the booklet, the word disability is paired with illness when talking about euthanasia. Disability is used in this context 12 times in the book. And according to this children's resource, if you have a disability, you may be justified in feeling that your life is not worth living. Unfortunately, as we've learned from Canada, Australia and Belgium, they've broken the ground first, and now New Zealand has the potential to slide down the slope. David Seymour, ACT leader, has already indicated that there's worse to come, and he wants the law expanded.
Now the man who shaped the bill says it needs to be reviewed, the eligibility widened.
I think we can already see in the numbers some concerns. It's excluding people who have a long-term condition, and that means a lot.
Yep. It's going to expand. Euthanasia and assisted suicide put many of us in danger because nothing in these laws guarantees the protection required for vulnerable people, including disabled, elderly, depressed or anxious, and those who feel themselves to be a burden or under financial pressure. The international evidence backs up these concerns. It's why so few countries have made any changes to the law around this issue. But we can live without euthanasia. We need to speak up. We need to protect our most vulnerable.